Good morning, Excellencies, Honorable Ministers, distinguished delegates. Welcome to the first meeting of the Specialized Technical Committee on Health, Population, and Drug Control. May I request all delegates to please stand up for the AU anthem. Thank you very much, Excellencies. You can have your seats, but as you're sitting down, before I call on my commissioner, His Excellency Dr. Mustafa Siddiqui Kaloko, can I ask you again to please stand up for a moment of silence on behalf of more than 10,000 Africans who had lost their lives to Ebola, for us to maintain a moment of silence on their behalf. Thank you very much. Thank you very much. You may sit down. You may be seated. To give the opening remark, I have the honor of inviting His Excellency, Commissioner for Social Affairs, Dr. Mustafa Siddiqui Kaloko, to give us an opening statement. Thereafter, I will call on the representative of the Minister of Kenya and the Honorable Minister from South Africa to give some words. Commissioner, sir, you have the floor.
Honorable Ministers of Health here present, Honorable Ministers in charge of population, Honorable Ministers in charge of drug control, experts, members of the diplomatic corps, embassies accredited to the African Union, representatives from the UN agencies, representatives from developmental organizations, civil society organizations, excellencies, distinguished ladies and gentlemen. Now, on behalf of the chairperson of the African Union Commission, Dr. Nkosazana Dlamini Zuma, I have the pleasure to welcome you to the headquarters of the African Union and to the first specialized Technical Committee on Health, Population, and Drug Control. Now, the inception of the STCs, that's following the mandates of the Executive Council in 2012, allowed sectoral ministries dealing with cross-cutting issues to converge, discuss, and arrive at a common ground on those issues, which hitherto was not possible with the ministerial conferences. The composition of the current STC has brought together the three relevant and interconnected ministries. I do not need to emphasize the benefits of the combined meeting of health, population, and drug control, but only to call upon you to ensure that we properly harness the opportunities that we are presented with through the convergence of the three ministries and their individual competencies and enormous expertise. Health and illicit drugs are linked, as most mental health issues are closely connected with drug abuse or the high consumption of illegal substances, especially among an important segment of our population, and that is the youth. The truth is, there are negative health effects associated with every illegal drug out there, and some of them can even be fatal. Similarly, population and health are linked. For example, as populations age, the tendency of susceptibility to succumbing to an infectious disease increases in tandem with a high incidence of non-communicable disease. As a result, population dynamics have an impact on the ability and capacity of member states to ensure universal health care and social protection services for their citizens. Population dynamics also have critical impact on the epidemiological situation of a country. Population dynamics and illicit drugs are also linked, for example, to rapid urbanization, industrialization. Population growth in developing countries can fuel the demand for illegal substances by as much as 25%, sometimes in just a period of 10 years. And it has been projected that developing countries will shoulder the burden of global drug problem in the coming decades. Ultimately, health, population, and illicit drugs have an effect on development. The cost of drugs on the economies of the continent alone runs into billions of dollars in increased healthcare costs, crime, lost productivity. Population dynamics have implications for economic development, labor and labor markets, income distribution, poverty, and social protection. Diseases hinder country performance too. Through lower life expectancy, absenteeism from work and school, low productivity due to poor health, increased health budgets with a minus or diminishing funding to other meaningful and job-creating sectors. This means that the collective efforts of the sectors gathered here can lead Africa to unprecedented development as compared to previous ministerial meetings that dealt with specific issues relevant to the concerned ministries. Let us therefore take advantage of this important platform to deliberate beyond our respective sectors by focusing on the interrelationships and at the same time viewing development as the ultimate outcome. Honorable Ministers, I wish to draw your attention to the agenda items that include Ebola and polio eradication, discussing the public health drug control nexus, implementation of the Addis Ababa Declaration on Population and Development, and the establishment of the African Center for Disease Control. You may agree with me that all these are important subjects, and I wish to call upon you to approach them from the perspectives of lessons learned and the way forward with considering the challenges that have been discussed in previous meetings. For example, the Ebola outbreak has been an eye-opener for all its devastating and overstretching our weak health systems, leading to unprecedented response and solidarity amongst member states, UN agencies, developmental partners, and the private sector. The lesson learned is that Africa has the potential to address its own problems. The Ebola response, though disjointed initially, has also validated that effective coordination and timely response are key elements in tracking future outbreaks. Another lesson to be learned was how African Union member states galvanized and united themselves to oppose the scheduling of essential medicines at the just ended 58th session of the Commission on Narcotic Drugs in Vienna. The response did not just demonstrate that African Union member states can unite, but also demonstrated that health and drug control sectors in Africa can come together for a common purpose. Even though we have learned these important lessons and made great responses to the said challenges, I still wish to express concern that all the actions were actually reactions to challenges, not something we had prepared for beforehand. Should we wait for challenges to serve as a stimulus for us to act? Or should we foresee challenges and act before they occur? Africa should not wait for challenges to occur in order to respond. We need to be proactive rather than reactive. I therefore urge this meeting to foresee our continent's challenges and develop appropriate responses before these challenges actually occur. Honorable ministers, ladies and gentlemen, as our union is still celebrating the 5th decade of its existence, I wish to underscore that Africa is only seeking to define its vision for the next 50 years under an initiative termed the Agenda 2063. As you may be aware, the African Union's Agenda 2063 is a call for action to all segments of African society to work together to build a prosperous, a united Africa based on shared values and a common destiny. It is the African Union's view that Africa must do things very differently to take advantage of the current momentum towards Agenda 2063. And that in order to achieve the African Union visions of an integrated, prosperous, and peaceful Africa driven by its own citizens and responding to a dynamic force in the global arena, innovative transformation through a people-centered approach should be our benchmark. I wish to inform you that the Agenda 63 is not only timely, but intends to capitalize on Africans' current opportunities in order to lift the continent's people out of poverty and misery. As I have mentioned earlier, health, population, and drug control sectors are key sectors in Africa's development agenda, and these sectors could be some of the many, but key means to the attainment of the aspirations of the Agenda 2063. Therefore, as we deliberate, we also need to think of how our outcome will contribute to attaining the targets of Agenda 2063, which is truly an African initiative. Honorable ministers, as I conclude, I wish to remind this gathering of the following. African problems can also be solved by Africans, since we are the ones with the greatest interest in solving the problems anyway. 2, African solutions really do exist for African problems. And lastly, finally, Africa, let's be confident, has the capacity to address its own problems. Every stakeholder in this meeting should view him or herself as an important stakeholder in this grand design of transforming Africa from this generation and those that are yet to come, with the hope of a better and brighter day for all, and in the spirit of Africans helping Africans. With these words, I hereby declare the first session of the Specialized Technical Committee on Health, Population, and Drug Control officially open, and I thank you for listening to me. Thank you, and good morning.
Honorable Ministers, distinguished delegates, Excellencies, I sincerely thank His Excellency Dr. Kaloko, Commissioner for Social Affairs, for his opening remarks. May I now invite the representative of Kenya as the outgoing chair of the Population Commission to give us some few words. You have the floor, sir.
Thank you, Chair. His Excellency Dr. Mustafa Siddiq Kaloko, Commissioner for Social Services, Honorable Ministers, distinguished delegates, ladies and gentlemen, good morning. I'm here to represent the Cabinet Secretary, Devolution and Planning for the Kenya government, and I'll therefore proceed to read her remarks. I'm indeed grateful to have been invited to this key forum of the first meeting of the Specialized Technical Committee on Health, Population, and Drug Control, whose theme is Challenges for Inclusive and Universal Access. The theme resonates very well on the need to have the entire population in our various countries having access to quality services at all levels. The theme is also in line with the call by the International Conference on Population and Development of 1994 for universal access by 2015 to reproductive health care, including voluntary family planning, assisted childbirth, and prevention of sexually transmitted infections, including HIV. These agreements made at the highest level are crucial to us because it gives the issues of reproductive health a human face and brings it alive in our households. Honorable Ministers, ladies and gentlemen, the Kenya population has continued to grow over time to a total population of about 38.6 million people. This population is growing at a rate of 2.9% annually, and that results into a population of 1.1 million every year, and currently estimated at 43 million. The high population growth has serious implications on the performance of key sectors such as education, health, agriculture, manufacturing, among others, thus affecting service delivery and overall quality of life for most Kenyans. The government of Kenya has put in place measures to reduce this high population growth in our efforts to ensure that Kenya has a manageable population for quality life. Such measures include repositioning of family planning and initiating successful education programs that enroll and retain girls at least up to secondary level education, which will significantly contribute to reduction of teenage fertility and overall fertility in the country. The government also introduced a budget line item in the Ministry of Health in the year 2005 for family planning commodity security, which stood at about US $6 million by the financial year 2013-2014. The Kenya Vision 2030 aims to provide equitable and affordable health care of the highest standard at all levels to our people. It is important to note that Kenya has restructured healthcare delivery system, shifting the emphasis to prevention and promotive health care. The emphasis is on access, equity, quality, capacity, and institutional framework. Honorable Ministers, ladies and gentlemen, Kenya has just released the recent 2014 Kenya Demographic and Health Survey. The results show noticeable improvements in fertility-related indicators. The total fertility rate is now at 3.9 children per woman, having declined from about 4.6 in the year 2008. The total fertility rate in rural areas is about 4.5 and 3.1 in urban centers. If this trend continues, Kenya is on the right footing to reap the benefits of a demographic dividend. Level of current use of contraception is most widely employed, and valuable measures of the success of family planning programs have been put in place. The DHS results indicate a contraceptive prevalence rate of 58% for all methods and 53% for modern methods, which is an increase from 46 for all methods and 39 for modern methods, respectively, from 2008. Honorable Ministers, Kenya's population is youthful, with about 36% of the population aged between 10 to 24 years, and slightly over half of the population is aged below 18 years. This signifies that the country has a youth bulge. The young people, both in and out of school, need to get reproductive health information and services, especially those in hard-to-reach areas and most at-risk populations. The Minister of Health has been offering youth-friendly services, but the challenge has been limited resources to establish, equip, and man the centers. The youth empowerment centers, which have been established in every constituency, are meant to respond to the young people's reproductive health and development needs. These centers act as one-stop shop where young people can access information and services on reproductive health, including family planning, voluntary counseling and testing, VCT, acquire life skills, and undergo training in various vocations. They also access internet services and games and sports. The government has also put in place revolving funds that young people can access and empower themselves economically, therefore improving their livelihoods and those of their families. The government launched what we call the Uwezo Fund to enable young people access capital to start businesses, and other funds. Other funds also include the Youth Enterprise Fund and Development Fund, and also the Women Enterprise Fund. There is also the 30% procurements put aside by government for young people, women, and persons with disabilities, so that in every government department or ministry, 30% of procurement is meant to go to these particular populations. Honorable Ministers, ladies and gentlemen, proper care during pregnancy and delivery is important for the health of both the mother and baby. In Kenya, the government has put in place mechanisms to ensure that there is universal access. Provision of health services is free. This has contributed to the improvement of maternal health indicators, with 96% of mothers who visited the antenatal care clinic being attended by a skilled provider. About 6 out of 10 women were reported to have delivered in a health facility, leading to reduction in maternal deaths. There are, however, county differentials in maternal mortality rates that need to be addressed. Honorable Ministers, the First Lady of the Republic of Kenya, Ms. Margaret Kenyatta, has been organizing what we call the Beyond Zero campaigns, where together with stakeholders, they raise funds to purchase at least one mobile clinic for each of the 46 counties. In addition, the 15 counties that have the highest maternal mortality rates have been earmarked, and the national government is also collaborating with the county government in putting in place mechanisms to address the high maternal deaths in those particular counties. So those counties represent about 98% of maternal death. Therefore, if we can focus on them, we should be able to reduce maternal mortality deaths in Kenya. Finally, I want to wish you well as we deliberate on the challenges for inclusive and universal access, and also get solutions for these challenges so that we can move forward as countries and improve quality of life of our people. Thank you very much.
I thank the distinguished representative of Kenya for his statement. I now have the honor of inviting the Honorable Minister from South Africa in her capacity as the outgoing chair of the Conference of Ministers in charge of drug development. Honorable Minister.
Thank you very much, and let me recognize the Commissioner Ntate Koloko, the ministers responsible for health, for population, and for drug control, members of the diplomatic corps, distinguished guests, ladies and gentlemen, good morning. Good morning. Thank you. That confirms for me that there are people in this room. Firstly, we'd like to thank the Secretariat for ensuring that we are all here this morning. But we opted to just highlight some of the aspects of what our agreements and discussions were as we concluded the session last year. And for us, it is important that as ministers, we take a moment to just remember as we start in the consolidation of the establishment of the first STC that we are meeting, that we need to ensure that the issues of drug control don't somehow disappear in the a bigger, broader agenda as we would be combining three very diverse issues. We also acknowledge the interaction between all of these issues in terms of drugs. However, we'd like to just highlight a few issues that we feel that it is important that as we meet today, where we would be discussing aspects, whether it's on population, whether it's health issues, we should not forget the challenges and the impact drugs has on the work we are trying to do. Allow us to also indicate that as we discuss the issues of drug control, whether socially, economically, or the criminal components of it, we must never lose sight of the importance of human rights and the dignity of those that find themselves challenged by these issues. We need to remember to strengthen the families, because for us to be able to win the elements of the fight against drugs, we need to make sure that we've got stronger families that are the first call to enable and also the first support to be able to assist those that find themselves trapped in this circle. If we are able to ensure and ensure that all of the above happens, we would go a long way in ensuring that our young people are active and are able to contribute to Agenda 2063, or else we will find ourselves in a very big social dilemma. Allow me to also indicate that I think as we meet this morning, we need to recommit ourselves to the acceleration of the implementation of the AU Plan of Action on Drug Control 2013 and 2017. We need to commit ourselves to undertake policies and legal reforms to focus on a balanced and coordinated, holistic and multi-sectoral approach to drug control, lest we forget. We also need to ensure that we establish and strengthen implementation, coordinating mechanisms and structures for drug control, both at a regional and national level. It is important for us, as we meet this morning, to also recommit ourselves that we are going to put each and every resource required to enable us to, one, raise the level of awareness amongst our children, young people, the elderly, and with a special focus on women and young women. We need to ensure that our coordination mechanisms, as well as our monitoring and evaluation systems, are up and running and are very functional, or else we won't be able to measure the progress that we are supposed to make. As the African Union focuses on the issues of women, we must never forget that women find themselves as drug mules across the different continents of the world, but also that their biological makeup is beginning to become a very important component of drug trafficking. So together as we meet, we need to always focus on the challenges women face and the vulnerabilities that lead them to finding themselves being drug traffickers. But also as we speak about women, we need to also ensure that pregnant women are not utilizing drugs as we all bring our heads together to prevent disabilities. Because at the end of it all, we will be having an increment of children born with severe disabilities due to the drugs. We need to deal with the issues of trafficking because they remain a challenge both internally across borders, as this is a challenge that the African continent needs to find solution to, and also that our borders, as soft as they become, we need to find a way that they are not abused due to drug trafficking. Allow me to wish all of us well as we deliberate, but also take the responsibility to ensure that the issues of drug control will find its way across population, across health issues, because none of the two would succeed without us fighting the scourge of drug control. I wish you well, and thank you very much for the opportunity.